Hello, everyone. Thank you so much for coming out here tonight. I'm glad to see all your smiling faces. Over 25 years ago, I envisioned a future where women were empowered to ask questions and demand answers about their sexual health. As pure romance grew, so did the number of women coming to me with their very real problems, desperately seeking answers about sexual health issues that were affecting their lives and families. It became more obvious to me that resources in this area were seriously lacking. That's why I started the Patty Brisben Foundation for Women's Sexual Health. To date, we have raised over $4 million for research and education. Last year, we launched a new initiative, a speaker series called #SexualHealthMatters. At our first event, we didn't know what to expect. We didn't even know if anybody would even show up, but they did. 80 women showed up, eager to learn more about their sexual health. It was incredible and humbling. Tonight, I'm proud to say we're growing. Look around the room. It was growing so much that we decided that we were going to live stream. So say hello to everybody out there that's watching. Hi. Looking around you, there are many men and women here tonight ready to take matters in their own hand for you and for your children. This evening, we continue the conversation, focusing on sexual wellness with our youth. Listen, the talk is hard, and it starts early. We all dread it when our innocent little ones look up and say, "Hey, Daddy, where do babies come from?" "But Mommy, how did that baby get in your belly?" Gone are the days when we could say, just go ask your mother. Or that's a conversation for you and your dad. Both parents need to get comfortable talking to their kids about their developing bodies, feelings, regardless of gender. The world we live in is changing. We're seeing more gender-expansive and gender-creative children. How do we as parents have age-appropriate conversation to responsibly lead our children into a more accepting future? As parents, we do our best to raise happy, healthy adults. That's the goal, that's the job. So how do we open the lines of communication with our children so later in life they are empowered to embrace their sexuality and enjoy a shame-free life? Only with communication and education can we bridge this gap. I look forward to starting this conversation tonight. With that, I'm so excited to introduce our group of sexual health experts. The list is so long, I think it's 3 pages on everything that they've accomplished. So we're going to start with Dr. Rula Kanj. She's an assistant professor in the Department of OB and Gynecology at the University of Cincinnati College of Medicine. Her focus in pediatric and adolescent gynecology at Cincinnati Children's Hospital Medical Center is on conception, transgender health, and menstrual irregularities. We need you here tonight. Dr. Suzanne Sampang is an associate professor of psychiatry and behavioral neurosciences. She is the co-director of adolescent inpatient psychiatry at Children's Hospital Medical Center. Dr. Sarah Pickle is an assistant professor at the family medicine at the University of Cincinnati College of Medicine, as well as a board-certified family medicine physician focused on adolescent and transgender care at UC Health. And Dr. Corinne Lehmann is a professor in the Department of Pediatrics at the University of Cincinnati College of Medicine and the director of Family Care Center for Pediatric and Adolescent HIV at Cincinnati Children's Hospital. I'm so very thankful to each and every one of you for your expertise with us here tonight. So, you ready to get this conversation started? I know I am. Dr. Kanj. Parents have so many decisions to make about how to address changing bodies with their children. The conversation, it starts early, like how to identify and talk about physical parts of their bodies. You've all heard the little nicknames like the little Winky, the hoo-ha, the flower. The list goes on and on and on. Dr. Kanj, what body parts are important to identify by proper names? And why is it important? Why is it important for our children to know proper terminology for their private body parts?
Thank you for the question, and thank you for having me here tonight. I wanted to just start by saying that I see young girls through teenagers, through young adults, and a lot of times it's a pretty vulnerable and challenging time in their lives. And what makes my job sometimes a bit easier is when the stage has been set already at home. So one of the most important things to convey to your kids is that it's okay to talk about their anatomy, their body parts. And the reason to give appropriate names to things is that it teaches them it's not something to be ashamed of. These are normal parts of their body. They should then feel comfortable talking to you about it, rather than trying to learn that information from somewhere else. Another really important reason to give accurate, appropriate names to body parts is that it helps kids to then express discomfort when they have a specific complaint. So a lot of times we'll encounter situations where a girl will say, my bottom hurts, or my private area hurts, and that's at least getting us closer to where we want to be. But if they can accurately identify the specific anatomy, that definitely helps in expressing discomfort, and also the situations we never want to think about, but expressing when they might feel uncomfortable in a situation, if there is concern for some kind of an assault or some kind of inappropriate touching. So the earlier we can start with these things, I think the better. And it can be quite awkward, especially as a parent, to talk to your kid about what parts to use for their anatomy. So we have heard all kinds of different names given to these body parts that are quite interesting. And when I first meet a young child, I always ask, what do you refer to that part of your body as? And I've been pleasantly surprised by the number of girls that will now tell me that they call it the vulva or the vagina, and they actually use that term. So it's
That's awesome.
It's really helpful, and I think the parents realize how much more clear communication they can have with their kids when they start using those terms early. It does make some people uncomfortable. Sometimes the preschool teachers or kindergarten teachers or the nanny goes, we can't use those terms, that's too intimate. But I think it's really important to show kids that these are normal, natural things that they shouldn't be ashamed to talk about.
Thank you. Got a lot of work to do with our skulls. Anyway. I just say it the way it is, people. Earlier, I briefly touched on the where do babies come from question. As a gynecologist, how do you recommend parents answer this? That's a common question. And how does the conversation differ with children of different ages?
So this is another really important conversation to have with kids. And it actually can start quite early, depending on the level of curiosity and interest that a kid may express. The key thing when you're talking to a young child about these issues is to lay the groundwork. Essentially, talking about things like appropriate touch can be a good place to start. You don't need to lay out all the details. You don't need to get really intensely into the conversation. But a lot of times, setting it up as a situation of these are private areas, and sometimes we've identified what those private areas are, and talking about what appropriate relationships are between people, which things you can't touch on somebody else unless you're in an intimate relationship with them. That's kind of a way to start with the 3, 4, 5-year-olds. And the nice thing about starting that early is that because you've laid the groundwork, you can then add details. A key thing with these sex conversations is that it's an ongoing discussion, right? So if you've laid the groundwork early, you can start adding to it. And again, it's all about kids making sure that the kids know they're comfortable talking to you. They're comfortable talking to you about this, and then they end up getting more accurate information rather than hearing whatever they do from their friends, which, as we know, can be wildly inaccurate. They at least have a safe place to go where they know you're not going to say, nope, that's not something we talk about, that's dirty or inappropriate. They know I can actually go to my mom or dad and talk about these things in an open way. So starting with appropriate touch, laying the groundwork for kind of safe relationships, and then building from there is a good way to get that conversation going.
Great. Okay, we've also discussed how sexual health conversation should start early. But as children grow, continuing that conversation becomes even more important, especially when they hit puberty. When is it normal for children to enter puberty, and how can a parent help prepare their children for this change that puberty brings?
So puberty is one of the really challenging times that, again, I deal with a lot in my patients. And I mostly take care of girls. So for girls, the typical ages of entering puberty, it's anywhere between 8 and 12, actually. So it's pretty wide range. And the rate of pubertal changes also is different in different girls. So for some girls, from the time that puberty begins to their first period is only 1.5 years. For others, it can take up to 3 years. If we see changes before age 8, or if there aren't any pubertal changes by age 13, we start to investigate and look into, is there some kind of a medical condition going on that needs to be treated in some way? For boys, like I said, I don't take care of as many boys, except in my transgender population, but boys anywhere between 9 and 14. So in terms of preparing kids for those changes, one part is discussing the body changes that they may expect, but another important part is kind of giving them a hint as to the confusion they might feel with differing emotions. So part of pubertal changes, as especially my colleagues here know, is not just the bodily changes, but their brains are changing. And they start to develop emotions that the rational part of their brain can't handle quite yet. And so a lot of these things can be confusing to them. They have these new complex emotions that they can't really handle, and they may not understand their reactions to things. So as a parent or a caregiver, expressing to them that there are going to be some physical changes and some mental changes that might make them feel weird, and that's okay, and that's something that they can talk about, and that we'll get through this together, because it really is a journey over quite a few years. So it can be definitely a challenging time for kids and their parents, because it can test the relationship and the boundaries of that relationship quite a bit. But it can also be a really good opportunity to get really close with your kid, and they know that they have a safe place to come home to when those emotions are just too much for them to understand.
This brings me to my final question. At what age would you recommend a parent seek out a gynecologist for their daughter?
So that's become a more important question in recent years, I think, as we realize that a lot of conditions that may affect girls and young women and adults may start actually earlier than we think. And also because our job as gynecologists is not just to do pap smears once people turn 21 or provide birth control when that's needed, but to, again, lay the framework for safe and healthy relationships, talking about sexual health before it's even something that is relevant to them, and setting the stage for what may come later. So the official recommendation from the American College of OBGYNs is that the first gynecology visit is somewhere between ages 13 and 15. But most girls, it's important to emphasize, won't need a pelvic exam at that first visit. And I think that's been something that once girls realize that they're not getting an internal exam at the first visit necessarily, that definitely makes them more comfortable coming to us and talking about periods and body changes and the various problems that come with those things. On the other hand, sometimes, as I said, we'll see very, very young girls, and those girls may need a physical exam because they're coming because of a specific complaint to do with the genital area. But if the issue is heavy or painful periods or an ovarian cyst or something like that, or just let's make sure that things are healthy. Are these periods regular like they're supposed to be, or is there something else going on? Sometime between ages 13 and 15 is a great place to start.
Thank you so much.
Absolutely.
Dr. Sampang, we're happy to have you here tonight on this very important topic. How do we walk fine line between parenting and friendship? We know in order to raise strong and a well-adjusted person, we can't always be their friend. But how can we make sure that they're still comfortable coming to us when they have concerns or ongoing things in their lives? How do we build that relationship?
Yeah. Thanks for the question. Also, thank you for having me here tonight. I love that you started out earlier in the introduction, Patty, about talking about like the role of a parent is to prepare your child for adulthood. And that's your job. And I think that's a good benchmark and guide for how to navigate that fine line between friendship and parenthood. I think there's some common things between friendship and parenthood. You want both to be respectful, honest relationships. You want to be able to have trust with each other. You want to be able to have open communication. I think this is going to be a common theme that we're all going to say is open and honest communication so that things aren't mystical or scary or secretive with your kids. But then there's some important differences when you're a parent. You know, because your role is to prepare them for adulthood, you're really in a teaching role. And so you should consider yourselves teachers. You're teaching them about values. You're teaching them not only about your own values, but helping them develop their own personal values. You're teaching them about responsibility. You're teaching them about accountability. You're teaching them about how to think before they act, before they make decisions. And so inherently, that's a different setup than friendship, because friendship, you think of a friend as your equal and you're on the same grounds, you know, equal footing. With parenting, that's not the case. It inherently means that you are in a position of authority and you should consider yourself in a teacher role. You wouldn't accept it if your kid's teacher was their friend and hanging out with them and having friendly, those types of conversations. It's the same way as a parent. And so you want to be able to consider yourself as taking on and owning that role. And with it comes the need to set limits, set boundaries. You're teaching them to make right decisions, so you want to praise them and reward them for making right decisions. But you also need to set limits and tell them when they're maybe heading in the wrong direction, and maybe that's setting consequences. And so I think that's, as a general rule, that's how I would instruct parents to navigate that line.
You're good. I know you're passionate about supporting the mental health of children. We hear horrible stories in the news, like cases like Larry Nassar, the gymnastic team doctor convicted of molesting hundreds of young people. Many people think it was just girls, it was boys too. Many of the victims' testimonies emphasized not understanding their bodies enough at their age to even realize that they were being abused. How can we properly prepare our children to understand their bodies and understand consent in a way that both protects but it doesn't frighten them?
Yeah, that's a great question, Patty. I think it goes back to what Kanj was talking about, is setting foundations early on, demystifying the female or male anatomy, demystifying the whole, you know, what is appropriate and inappropriate. And I think when you take away that mystery, then you take away the confusion. Some of those other foundational aspects, I think, are teaching kids assertiveness. You know, I think I grew up in an Asian family, and so it was like you don't talk back to adults, and you know, speak when spoken to. But assertiveness doesn't necessarily mean you're disrespectful Assertiveness means that you have the confidence to ask a question, or if someone's making you feel uncomfortable, to tell someone about it. And so that's an important boundary. So as we start to have those foundational conversations with kids when they're really young, and that can start 3, 4, 5. If someone's saying something mean to you, stand up for yourself, tell an adult, we can help you, you're not alone in this. That will translate to when they're teenagers. And then it's also, when we're talking about having the confidence to, if you're not sure about someone, to seek help from a trusted adult. And hopefully that's you as a parent. Maybe that's a teacher, or maybe that's someone that they trust in their life, their gynecologist, to ask the question, well, this made me feel weird. Is that right? Was this wrong? When we talk about appropriate touch with little kids, we have to qualify it. Like, it's okay when grandma wipes you after you potty. That's okay. And it's when we go to see the doctor, they might be touching you in your private area. That's okay, because I'm going to be with you the whole time and you're going to be okay. You lay the groundwork and the foundation when something deviates from that maybe it's not okay, and they can ask the question.
Okay. We always have a warm-up at our peer romance parties.
Yeah.
So I've got you guys warm now. Everybody real warm in here? Okay. This is a commonly asked question. As parents, we may find our children masturbating. How should we respond? And should we respond differently based on their ages? Yeah. It's getting hot in here.
Yeah, great question. So the first thing, and we do this when we train resident doctors, the first thing to do is to check your own pulse. Don't freak out. And to know that it's normal. If younger ages, 3, 4, 5, they're exploring their bodies, and that's okay. And there's really real biological reasons for that, for them to start feeling sensations in places. And just like adults, when something feels good, they want to keep doing it. Mm-hmm. And so the first thing is, don't freak out. It's normal. What you do want to do is have a conversation about maybe what are the appropriate circumstances to do that. That is a private thing. And so, a sleepover at Nana's house with your cousins, it's probably not the right time to do that. If you're at daycare and it's nap time, no. But when you're home, it's fine to explore your body. That's your body to explore. But at home, in private, it's a private thing with the door closed. And so I would say that the conversation is different depending on the age group. So in the younger kids, it will be, just that. It's private, it's fine, explore your body. And the theme will be the same throughout, whether they're a younger kid or a teenager, but the questions that the child may ask you will be different, and a teenager may want more details. And so again, we have to kind of check our own discomfort with that. And I think always a good stance is to be honest. Don't deflect it, don't avoid it, because I think then you lay the groundwork that this is an okay thing for us to talk about. And I'm here to, as your parent, if you have questions, I'm a safe, reliable person that won't give you any misinformation. Answer the question. Sometimes what might come out of that is like, well, do you masturbate? That's an okay thing to deflect. Again, it's a good thing to say, like, as I said, this is private, and what I do doesn't have to do with your body, and it's a private matter. So I don't know if I answered your question.
You did. I was just taking a moment to reflect. I didn't answer that one right. Okay. Kids are funny. Kids are funny.
I have to say, though, it's good to use humor and to acknowledge your own discomfort with the conversation, because that makes it real. You're not an expert on parenting, and so to laugh about it, just like we just did, kind of takes the tension out of it.
Exactly. All right. So, Dr. Sarah Pickle, we're thrilled to have you here tonight on all of these important topics, especially sexual health and gender disparity. First question is there a difference between how we should address our children in these conversations? What is the same and what is different?
So, am I on? Oh, I'm on. I think when we're talking about sexual development and sexual wellness, we're going to be having similar and parallel conversations regardless of gender spectrum, regardless where our children and patients identify on the spectrum of gender. We want the same things for them. We want them to be healthy in their interpersonal relationships. We want them to feel connected to people that are like them and that people that are different from them. We want them to value their own bodies, and we want them to feel safe talking with us as their doctors, as their parents, about what feels good and what doesn't feel good, and that gets down to more of that inappropriate touching. We also want to instill in them the ability, when they're ready to express to us who they're attracted to, who they want to love, and what that's going to look like for their life. So having a different conversation with a son or a daughter or a child really doesn't have to happen. It is the same core values. You might have different conversations based on what's happening in their body. Remember, that's not always based on gender either, and I think that'll be question number 2.
Yes.
But we'll go into that a little bit more, but really you can feel confident in that the framework for these conversations is the same, and asking children what they're experiencing, what's happening with their body will guide you into those conversations to match where in puberty they are or where in development they are.
All right. So, how does a parent respond to their child if their child is identifying differently than their assigned gender? Where can they seek information? Where can parents seek information and advice?
That is a fantastic question. I'm going to give you a really short answer and then a little bit of a longer one. The short answer is don't panic and love your kid. Okay, so that's number 1. Don't panic and love your kid. The longer answer is we need to have a better understanding that the terms of sex and gender aren't interchangeable. We sometimes use those terms interchangeably, but they're not. Sex is often known or assigned either before birth or soon after birth of a child, and we might think of sex as male or female, but sex is much more complex than that. It's a combination of chromosomes and hormones and body parts and genes. And so we might think of it as male or female, but individuals who are intersex may have a combination of hormones and chromosomes and patterns that follow a less common pattern of sexual development. So sex exists on a spectrum. So does gender. So gender is not assigned at birth. We might assign it to people, but it is not assigned at birth because it's an internal process. It's an internal process that evolves over time. Kids start exploring gender as early as 2 or 3. They know what body parts they have, they start to touch them and love them and be very curious. They also start exploring gender expression within the confines that we build for them because we are a society. We have things that we might consider masculine or feminine. Other societies have different things that they consider masculine or feminine, or things that are okay for boys and girls. All toys are okay. All clothes are okay. It's all okay. So it's very normal for 2- and 3-year-olds to start to have expression and gender roles and experiment with all kinds of things, and that's good, that's normal, that's fantastic. There are kids who are gender expansive, and Patty mentioned that term. And gender expansive means that, you know, that kid is just kind of not following the stereotype that we, as the adults and the generations before us, set for what a boy or a girl should do. Oftentimes, gender expansive kids are really comfortable actually in the sex that they were assigned or the gender that they were kind of told that they were, but not all gender expansive kids are. And kids who identify as transgender may feel a disconnect from the sex they were assigned at birth, the body parts they were assigned, or the gender that they were told they were supposed to be. And that is really where the love your kid and figure out what to do next comes in. The love your kid is important because when you look at studies about what creates healthy adults, all healthy adults, having a loving and accepting family is pretty crucial. And as a provider who also sees adults, I care for a lot of patients who haven't had that family structure. And so I see the downstream effects of what gender acceptance doesn't look like, right? What non-acceptance look like. So love your kid and then figure out what to do next. The figuring out what to do next could just be telling them, you know, it's okay if you want to wear pink. It's cool, totally fine. It's okay if you want to play with this toy or that toy. It's great to play with girls and boys and anybody. You can be friends with anyone. The second thing that you can do is talk to your kid's doctor, right? If there are behaviors that you're not sure, what should I do next? Like, is there something else I should be doing to support my child? Ask. It's never scary to ask. We're not going to give you scary answers. We just don't. That's just not our job. We're going to tell you you're doing great. We're going to help you along. The other thing is in Cincinnati, we have fantastic resources. We're so lucky to have Cincinnati Children's Hospital, where all of these colleagues work. I'm across the street. That have support systems for families that are exploring some of these questions and have support for kids and have support for adults. Oftentimes, the kids are fine. They're like, I'm great. It's you all adults that need to get with the program. So sometimes part of that is as teachers, as parents as teachers, as doctors as teachers, we got to figure out what we don't know so that we can meet our kids where they are. And I think that's what we do. There's other resources that are out there for families if they're not quite ready to have a doctor's visit about this and they just want more resources. You have a resource sheet that I think the Patty Brisben Foundation has put together for you. Another one is it's a document, and it's really meant for families called Supporting Transgender and Gender Expansive Children. There's a Welcoming Schools document that kind of navigates some of the questions about other families and what if my friends' kids are transgender or expressing gender dysphoria. And then the Family Acceptance Project is also a great resource to talk about what are everyday tools and sentences and words that we can use to support all of our children, whether they're really aligned and confident in their gender identity or whether they're in a stage of exploration and they need our support. So I told you it was going to be a long answer for part 2. I delivered, but hopefully I answered it.
Thank you. Okay. So I think many of you in this room know that I have a transgender granddaughter. And so family was on board right away. We, as family, you love your child. You love your grandchild. And you're going to do anything to make that child happy and feel all right and feel that they belong and that they're loved. But how is it people in this audience that may not have had this experience and their child comes home and says, you know, they have questions about a classmate or a friend that's identifying differently than their assigned gender? Could you answer that?
Yeah, so part of this goes back to the golden rule, right? To treat others the way that you want to be treated. And so that means to be kind and respectful. And so when we're talking to kids about treating other people, whether they are an ethnic minority, whether they speak a different language from us, whether they have physical attributes that are different from us, whether they are in a different gender space than us. It's really about respecting who they are. So kids might come home and say, Mom, last year Angela was a boy, now Angela is a girl. What's going on, right? So kids are actually smarter than us, so I'll just throw that out there. They're way smarter and they're way savvier when it comes to gender spectrum, but younger kids may not, have had that kind of social input yet. And it's okay to say, Angela was told that she was a boy when she was born, but she's a girl. And she wants to dress like a girl and she wants to feel like a girl, so you can be friends with Angela. Is Angela a nice person? Angela's a nice person. That's all you need to know. Right? So we can diffuse it. We can diffuse the fact that the boy, the girl, is this person a nice person? Is this a good person? Is this the person you should be friends with? Then done, right? WelcomingSchools.org has great sentences, like pre-programmed sentences that you can practice for some of these questions that kids throughout grade school and adolescence will come home with.
I'd like to carry in my back pocket always. Great answers. Okay, last but not least, we have Dr. Corinne Lehmann. Thank you so much for being here. This is a good one. This might raise a couple eyebrows in the room. There's a lot of controversy over the HPV vaccine. As parents, what do we need to know, and why is it important for parents to be educated on this vaccine?
Well, thanks for having me, and on behalf of my colleagues in the Division of Adolescent Medicine, because we have a lot of HPV vaccine researchers, so they've been trying to get the word out for a long time about the vaccine, and we're always trying to spread the word. So hopefully there's not much controversy left. I hope I can quell some of that, and I have a sense that probably the people in this room, I'm probably preaching to a choir, but if you've come to this, but also want to update people, it's not just about the kids now, it's been approved up to age 45. So there might be a lot of people in this room that now can receive this vaccine. It's important because it's one of the few tools we have in all of medicine to prevent cancer. It's exciting not to have to nag people about stopping smoking and things like that. Not that I'm still going to do that, but it's something I can offer that is going to prevent 70% of cervical cancer and 90% of anal cancer. So that's just amazing that we have tools that can prevent cancer at that level. And there's a lot of emerging research on prevention of oral and head and neck cancers as well. So this vaccine goes a long way, so I really encourage people to think about it. The strategy in children, it's approved down to age 9. Generally, most of the recommendations advertise trying it, starting the series at age 11 to 12, somewhere in that time frame. And I think that's a good conversation point because the 9 depends on the child and the development like we've been talking about. Some children might be ready to talk about, why am I getting this shot? What's this about? And I think a lot of kids, 11 to 12 is probably a better stage in their development in their brain to understand that it's preventing the most common sexually transmitted infection in the United States. So it's very prevalent, and there's even evidence that shows that even if people don't get the vaccine, the rate of infection is starting to go down in the US just because other people have gotten the vaccine and are now not spreading the infection. So it's really encouraging news. So if you start the vaccine series for your child, male or female, it's approved for both. If you get it in before age 15, you only have to do 2 doses now. It is a 3-dose series, I'm sad to say, for the audience if you haven't had it yet, and you're over 15. I will say, we do get, it hurts. That one's a toughie. It's sort of like getting a tetanus booster. I'm not gonna lie. We have kids faint when they get the shot sometimes. So if your kid's a fainter, we make them lay down and hang out for a little while after that one. Are you okay? To get up. So no problem, hang out, lay down. It does burn a little bit going in. And in fact, I know this for a fact because even though I'm outside the age range, I hate to say, I actually asked my doctor for it last week. So I got it as well, because I figure if you're going to talk the talk, you got to walk the walk. So he was on board. He's like, yeah, let's do it. There's data in Europe that shows the vaccine being efficacious in even older ages. So the safety is there. There were some reports about concerns about multiple sclerosis and some blood clots, but when they went back through the data, it's not there. And in fact, they went through a registry in Sweden and Denmark where everyone is on a health registry. So they've got 4 million people that got the vaccine, and there's no evidence that it caused either one of those conditions. So it's actually the safest vaccine that we have out there. It really is, as far as side effects goes. So I think it just gets a little bit of a bad rap because it hurts when it's going in. So I really encourage people to get it. It's just so exciting that we have something that can prevent cancer and prevent all the horrible complications that come with those cancers that can be really just devastating. And we've worked so hard to get women pap smears for so long. Wouldn't it be lovely if people didn't have to do that anymore? I think the ladies in the room would agree. So, I mean, I'm hoping that's where all this leads, but we're on the road, I think, for helping that out.
Excellent. What steps do you feel are important for parents to take to educate their children on the risks of sexual activity without scaring them into being afraid to continue the conversation about it?
I think it's a lot of the same things we've already been talking about, which is start the conversation early. So if they're comfortable with their body, as they become a teenager, that conversation gets easier. Although it's still, I think everyone has that. There's some discomfort and tension in that conversation always. You don't want to think about your kid, having problems with their sexual health. But that's where we want it to go. We want it to be sexual health, be healthy. Right. So let's talk about the things that would make you unhealthy and be sure that you're being safe. So I think you just have to acknowledge that it's a tough conversation. It's okay to giggle a little bit sometimes when you're having that conversation. Certainly if you're not the one in your household to have that conversation, get the other half, get the other trusted adult in your life, if it's your sister, your brother, or someone, if it's a respected aunt or uncle, that might go a long way too. So, because we're trying to teach a 16-year-old how to drive in my house, and I can tell you, my husband is not the one to do that job. I'm the one to do that job. So we divided that out. So he's the one that has to talk about that stuff, even though I'm the doctor. It just worked like that in our house, So I have to hand him the info and say, hey, go talk to him about it. So I think you have to be prepared for when your kid comes to you with the conversation. So that's what's so great about reading those lines in advance. So when that moment hits, because it's going to happen like Friday night at 10 when you're dead from a long work week and you're watching some Lifetime movie and your kid waltzes in and goes, hey, what are they talking about? You're like, oh man, no, not now. But if you have those lines at the ready, it kind of can make that conversation easier. But it's so much easier when they bring it up. So you've just got to be open to those moments when they come. It's just doesn't work so well when you sit them down and say, look, I'm going to talk to you and you better do this. And, kids are turn off, So be prepared for the conversation when it comes up. Places that could happen where, you're watching TV, a certain topic comes up on a show. That might be a great moment to, kind of say something about that. Has the school provided any education on it? As a teenager, at some point, you have to take health class in high school. That topic's going to come up. So if you know what's going on in your child's curriculum, you might be like, hey, how's it going at school today? What did you learn about? It might come up. So again, if you're ready to reinforce and talk about that, that's great. A place I can recommend to look for some lines, to be ready to have that conversation. The American Academy of Pediatrics has a great parent site that goes through a lot of these sexual health topics and a lot of the other topics we've talked about tonight too. And you can prepare those lines for when things do arise. And then maybe also having things ready to show, like just when girls go through puberty, having pads and tampons ready to show. You might need to have the condoms at home so you can appropriately demonstrate how to use those. I think a lot of people don't know how. Get the instruction book out that comes with them and really read it. It's fascinating. A lot of fun with bananas. No, and any things that you have around. But being ready to talk about that, have the kid, work. If your kid will go there with you, try to work and do it together and see what they can do. Because you want them to be safe and you want them to be healthy and prepared. You can still say your core values. I mean, at that conversation, hey, I don't think this is a good moment for you to be, having that type of relationship. But if you do, you better make it safe. Here's what people are supposed to do. Or if your friend comes up to you and asks you questions, you'll know what to tell them to do. So,
Okay, well, you might have thought that my questions were difficult here tonight, but we haven't opened it up to the audience, which give you really difficult questions. So are you ready to get that one started? Who's going to be my first person? Ooh, we got it going.
At what age, you said boys and girls can get the shot? Mm-hmm. I never knew that the boys could get the shot as well. And what age would be best for that? If
it's the same age range approval, so you could start at 9, but generally 11 to 12. The reason why a lot of people don't know about it, it was first approved in girls for a few years before they went on to boys. A lot of marketing, political, all sorts of factors tied into that. So I think that's why it's not on the radar so much, but it has been approved in boys for several years now. So yeah, get it for the boys too.
You have one, Karen, here. Go.
Hi. So I am one of the statistics with the HPV turning into cervical cancer. So I had a hysterectomy last summer. So with 2 daughters, is that, I don't know if this is a dumb question, but is that genetic? Now, are they more likely, if they do develop the HPV virus, are they supposed to be more aware of the chance of developing cervical cancer?
Do you want to
Take that to you.
Yeah, that's fine. So cervical cancer is actually one of those that, as Dr. Lehmann was saying before, we kind of know what the most common risk factors are. And unlike some of the other gynecologic cancers, such as uterine, endometrial cancer, ovarian, breast, there actually is not any hereditary component to it, meaning that your genetics or your history does not actually increase your daughter's history. Your history, I'm so sorry that you went through that. Luckily, you have a good perspective to then give your daughters to get them protected early, because really those are the best tools we have is between the vaccine and then regular pap smear starting at age 21 are the best tools we have to prevent cervical cancer and prevent that from ever happening. But luckily, no, there's nothing hereditary. It's more other risk factors like smoking, acquiring HPV, things like that actually do increase the risk of, as well as unprotected sex, of course, and multiple sexual partners. So those are all good lifestyle habits to reinforce with them.
Hi. So I have a 7-year-old son, and we are very open with him. We try to be everything in life, both sexual and otherwise. Not overly, but we talk about people love it, other people, it doesn't matter. So I just recently had this come up. He's playing baseball, and the coach says, oh, everybody has to see The Sandlot. So I'm one of these anal mothers. I go on Common Sense Media, and it's talking about, they're glorifying women. So I went ahead and watched it, having not seen it myself. And I'm struggling with things like, at what point do you expose them to things where normally you would not want them to see something where they're objectifying women or inappropriate, what I feel like at a 7-year-old is not appropriate things for him to see from a sexual nature. But at the same time, then I'm like, should I have that? Should I have him see it just to have the conversation? What's the line between avoid it or throw it out there, jump in the pool, and have the conversation? Because I'm going back and forth.
Yeah.
I can take that. So you know your child best, and so every individual develops at their own pace. And so there may be kids in that same age cohort where that may be appropriate, and it may be appropriate to start having that conversation. But just think about, where's my child at developmentally? Are they ready for it? And what are the pros and cons of exposing them to that? And then if you do expose them to that, to watch it with them, and again, be able to answer their questions and to put your values forth. Obviously, you don't support the objectification of women, and I would encourage you to say that to them. This is why I think this is not so great about this movie. And then it opens up the conversation if you decide to go that route. But I think it's a lot of it is, I just wonder, it may also be a question for was it a coach you said, or someone that said?
They play baseball or something in the movie or something, yeah.
About baseball, but I'm reading on it and they're talking about, it's probably more appropriate for a 9-year-old because they're Googling these women and, on the one hand it's like very old-fashioned, but on the other hand it's like,
Yeah. I think
expose them to it, or
Yeah.
Well, they're exposed to it.
Yeah,
Yeah,
I think
they're
you're
gonna
right.
find it.
And I think have
They're
confidence
exposed.
in the values that you're instilling in your child already and what they already know. And I think, yes, I think you're very right. They're exposed to that and probably a lot more in things like social media and TV and even the news. And so being able to put it out there, at least you're there, he's doing it in an environment where you can convey your values and talk about it.
But our kids could change that, They could change that, what is our status quo. So I think the non-acceptance of, it's normal, this has just been part of our culture for like 50 years. Okay, but, do we want something better for our kids? And so we have to be aware that it's out there. We have to be aware that we have tools to train this next generation of kids. If there's certain things that we feel like, gosh, wish my mom or dad would have done that with me, like we can do that, right? So we have that ability to make those changes in our kids, for our kids.
Hi, so we've talked a lot about open communication, but there's still going to be some ideas that kids are afraid, or not necessarily afraid, but want to explore themselves. And when I was growing up, we had one computer room and one access to the internet. Now kids have it in their pockets, on their phones, on their iPads. How do you teach them to use these tools responsibly and find the right information?
Someone said it's called restrictions, and I think, again, I think from a developmental standpoint, and your job as a parent is allowing them gradual independence based on where they are at developmentally and what they're ready for. And so that's why there's a lot of safeguards you can put in place as far as blocking certain websites. You can't block everything, just like you can't protect your child from every single thing out there in the world. But I think you can start to allow them, just like we do with screen time or things like that, you can start slowly and then monitoring and supervising them closely. And as they mature and you have confidence in their ability to take on those privileges and responsibilities, and you gradually start to slowly let the reins out a little bit. I don't know if Corinne.
I would agree with that as well. Yeah. I went to a great talk from Cincinnati Bell. They had a speaker that came to our school to talk about social media and how to help your child navigate that. Again, it's early conversation, like that's starting in elementary school now, of course. I just saw a pair of 10-year-old twins that both had, whipped out their iPhone on me the other day. I was just like, wow, okay. Yeah, definitely kids have it. And I think monitoring their access until they're in the right place, that you can trust them. I think it's key.
Okay, along those lines, I have a teenager, and we've always been the cool house. So we always have a house full of teenagers now, and then my 6-year-old is starting to have friends over. And I'm really good at being open with my children, but I also want to be a safe spot for other children. If they came and they maybe turned something onto their phone that was inappropriate, is it still okay for me to let them know that this is not reality, or this is the proper way to go about thinking this, and then talk to the parent after? Or should I be like, oh, shut that off and go talk to your mom?
Well, it's your house,
Yep.
right? So I think I think it's very fair to set boundaries with friends of like, these are things that we do or don't do in this house. And if somebody's doing something that you would say, that's just not something we do in this house, would you mind turning that off? And I think you're right, letting that parent know, hey, I told Susie that there was something that I wanted her to turn off. So that way, if Susie says, Mom, so-and-so told me to turn this off, Mom already knows that you just asked her to turn it off. So it's not punitive to that other child. You're not trying to overparent somebody else's child, but you're setting the healthy boundaries for what's good for your home, and when that person comes in your house, those rules apply.
Hi. I've been so excited about this. I have like 5 million questions that I'm going to have to just sit down with each of you individually. But I had to pick the most important. So I'm in a unique situation because I have a teenage daughter, and I feel like I really nailed the whole conversation with her. Like, I did such a good job. One of you mentioned knowing who your children are. And so it was easier with her. I have a 6-year-old little boy who is a pistol, and a 4-year-old little boy who is also a pistol. They're just wild. So I'm like nervous, I'm super pregnant, and they keep asking questions like, how did Daddy get that thing in there? And usually it's in public, so, that's always neat. And, I keep lying to them. I'm like, he just loves me so much.
That's right.
He loves me.
True.
That's right.
Not a lie. Probably appropriate public response. Yeah.
I need specific example of how to go about this conversation. My fear is that my 6-year-old's going to go to school and be like, so Daddy puts his penis inside Mommy's vagina, and then there's sperm that come out of it. You know how that goes. So I'm just so nervous. I don't want him going to school and educating everybody else's kids, because he's already taught kids at school cuss words. So, I need a little guidance here. How much do you share? Like, what do you say? And how do I get him to really listen when I say, this is information specifically for you that we don't share with others?
Well, from my perspective, I think the kids will guide you in that. I think what your 4-year-old will want to know is different than what your 6 or 8-year-old will want to know. So your 4-year-old might be very content with you saying, the baby was, your daddy put a seed inside of me, it's growing in my special place inside my body. And that might be all that, and if there's questions, you want to answer the questions. But, if they're asking specifics like, how did it get inside of you, then I think you say, Daddy's seed comes from his penis, and he placed it inside of my body. When you love each other. But I think you can use the word sex. What is that? Well, sex is an act done out of love where your dad, it helps your dad put the seed inside of my body. That helps join with my seed. You know what I mean? So it's hard because the amount of information, you don't want to information overload someone either. So the other thing, a good place to start often is, well, what do you know about it? Because they probably have already heard stuff. They have conversations amongst themselves. And so, for example, an 8 or 9 or 10-year-old might have already heard some stuff that maybe correct information or maybe misinformation. So you can start with, well, what do you know about it, or what have you heard? And then you can go from there.
I love that. And I do, because when I don't want to answer something directly, or I want to know what they know before I get into that conversation. So
I say, I have a 4-year-old, what do you think? What do you think? Just to see, like, what magical, mythical process does he think? Because when I was pregnant with my second baby, my then 3-year-old was very interested in how I got there and how it got out. Very interested in how it got out. As one of my friends says, there's really no great way for it to come out, right? So kind of we talked about that when babies are born, they come through people's vaginas. What's a vagina, right? I mean, so it kind of, and then at some point he was like, okay, like he was just done. It didn't go down this long, scary path that I was kind of thinking like, okay, how far are we gonna go down? And what's preschool gonna call me about tomorrow? Same thought, yeah.
Sometimes I've seen with the younger ones especially, talking about it as a specifically adult relationship And what I mean by that is that the danger of well, we just love each other so much. Well, I love daddy too.
Yeah, am I gonna, be pregnant?
Well, I love my friend. Can I get pregnant because we love each other? So saying it as, it kind of has to be somewhere between we love each other so much and that's how we got pregnant, and between here is the exact anatomy and a demonstration thereof with models. Finding something that basically clarifies it's an adult relationship. And they can figure out as they get older, you don't actually have to be over 18 to do it, but we can wait on that since they're only 4 and 6. So clarifying an adult relationship and that it's something that is private between the two of you, I think can also be a helpful aspect of it as well, so that it doesn't turn into telling the entire class, if that's something that you're concerned about. It sounds like you have to
wait for the conversation to come up again?
No.
Yeah, I don't think so.
Hello. So I'm a pure romance consultant, and this question I've gotten a couple of times from my customers. And I actually posed it in my VIP group with a couple thousand people and just to see what they thought. So I'm really curious what your perspectives are on the correct age for a girl to have a vibrator, because I know legally it's 18, but I know I could have benefited way before 18 having something to learn my body and having something to, and not even internally, I mean just externally learning the body. So I'm curious what your perspective is on that. And I have customers who are moms who come to me like, I want to buy a vibrator for my 16, 15-year-old daughter. What are your opinions on that? Like, what is a good age? Or, I mean, I feel like it's almost a maturity thing. Like, yeah. But what is a good sign, or what is a good?
I've already been asked that question 4 times tonight. So I'm going to answer this one for you. Stay tuned, because you have to come to the next one on April whatever. I'll give you the date later. April 4th. This one's birth to puberty, and I'm not going to put a panel of doctors to answer that one because it's not fair. So we're going to stay tuned, because I got to get all of them ready for that. Okay? Does that sound fair, guests?
Yes.
Okay. I know you guys think it's fair too. We will.
I was just going to say that I do have some teenage patients who use vibrators safely and healthily, and actually are not having sexual intercourse yet, but are comfortable masturbating, and vibrators have helped them into this too. So it can be a part of their healthy development, and we'll leave it.
It's okay.
There.
Okay, I am an educator, and I think when we first started this conversation tonight, you guys absolutely hit the head on the nail. We as educators and as our schools are failing our students. And I want to know what resources are out there for us as teachers, administrators, or any type of school personnel that we can get the resources out to our colleagues and to our children in our classroom.
I can take the lead on that one. So my son's elementary school had a wellness committee, and I was on it, and one of the topics that came up was the puberty education, the sexual health education was cut. I mean, it's gone. There's no funding for it. There's nothing happening. And we thought we were a pretty hotshot school, so like, why is that not happening? It's a public school, but so a couple of us, we're docs, and at Children's, we're like, whoa, and these are our kids going to the school. So we hustled together over a summer and found a curriculum from King County, which is Seattle, Washington. There's actually a free curriculum that they let you use. So, and it goes from kindergarten to 12th grade. It can integrate into any classroom. They're like free to use it, pick and choose, do what you want with it. So we took 4 modules out of it that we thought were appropriate for 5th and 6th graders, put it together, and then because I work at the medical school, we volunteered some medical students, no, they came freely, to help teach the 5th and 6th graders, because when we asked the kids, who do you want to come teach us? The parents, no, don't bring this health professional parents in. So we're like, okay, we're out. So, but they liked the medical students. So I can advertise, there is a group through Children's Hospital with the residency program as well, and medical students, and they will go out to local schools to teach on this. They're called Team House Staff, and I can try to get you connected later if you would like, because it does seem that reproductive health education budgets have been cut in so many schools. I remember going through, that's like the junior high dance where there's one, the boys are on one side, the girls are on this side. I remember that day in elementary school where one side of the cafeteria was the girls and one side of it, and then we had the talk, with the teachers, and they showed you all the, stuff. And that just doesn't, this doesn't exist anymore, they don't get to go through that fun, but, they really need that information. And I think the social media question from earlier, these kids are overwhelmed with, inaccurate things that can be out there. So being able to just clarify some of the terms and the concepts. We gave them boxes where they could write questions and put them in anonymously, and then the students read them out. And wow, there was some very interesting terms, questions, so we felt really great to be able to be there. And this curriculum that I've mentioned is evidence-based. It has been shown to work. It's shown to improve knowledge and improve some health behaviors as well. So it's not just somebody's bright idea. It's really been road tested, and it's a good curriculum. So that does exist out there. There are other products that schools can buy and other organizations that will come in. It's just the funding part, I think, for most places. It's just not there for this kind of work. But you're right. I think there's a lack right now.
Hi. Okay, so I'm married with 2 girls, 10 and 4. I love him. He's the best husband in the world. But the first time I said the word vagina to my 4-year-old, you would have thought I had just beaten someone to a pulp. He's like, you can't say those words to them. What's a good conversation piece to have with your significant other that it's okay to have those, because those are just baby girls, so they're not allowed to have those words?
How to get your significant other on board, right? So it can be challenging, especially when you have, it may be also just the way that it could have been your significant other's family. They didn't use those words, right? And that's probably a lot of people, especially at such a young age. But I think emphasizing a few things. 1, this is a healthy thing for her. 2, I don't want her to be ashamed of that part of her body and think that having a vagina or calling it that is wrong. And sometimes you can appeal to, maybe stereotypically, a father's protective nature by saying, this is protective for her in many ways, right? She knows how to identify these parts of her body. She's not gonna call it something like a flower or whatever else. She's gonna know that this is a part that is private to only mom helping me in the bath or whichever family member, or for doctors when mom is there. That's really a protective thing at that age, especially because kids are vulnerable in general, right? Especially before they have the language to describe things that are happening to them. And so if you frame it more as this is a healthy part of her, and I don't want her to be ashamed of having this. This is how a good way we can protect our daughter at a really young age. It might be a way to get him on board.
Call it what it is. That's what it's called.
Yeah, you call your hand, right. Your eyes, your nose, your ears. You've got to get comfortable. And your husband should have been here tonight. This was a perfect opportunity.
Tell him to turn on the live stream.
Yeah.
Oh, hi, okay. So I have 7-year-old boy-girl twins. And my husband and I have raised them we have toys for both of them. They can play with whatever they want. They can wear whatever they want. They can paint their nails if they want, whatever. And I feel like, though, even though I didn't grow up this way, they're so comfortable with their bodies that they're getting to an age where they're real, we're very specific about parts. My son knows the difference between a vulva and a vagina. Of course, so does my daughter. And but is there an age where I should kind of maybe guide them more towards having a little more privacy. I mean, they'll just walk around naked and like look at, take pictures of each other's butts, and then I have to tell them to delete that because my husband's a federal prosecutor and that could be child pornography. And, so then I catch them taking more pictures of each other's butts and they're like, don't worry, we're deleting all of them, and so like I it's sort of funny because like I really grew up completely the opposite from this, and I want them to have the right vocabulary, a healthy, non-shamed attitude. But where do I kind of, especially as they start to enter puberty soon, and more, how do I, without shaming them, be like, let's kind of keep our clothes on and stuff.
Yeah, I think some of it is kind of those conversations to have where you're going to say, in the next few years, there's going to be some changes in your bodies that are happening, and your changes might be different than your brother's changes, and there's going to be experiences and things that are happening that you might not want to share with others. They might feel a little bit more private, and so to frame it in, that there might be behaviors forthcoming and setting those healthy boundaries. I think when we talk about taking cues from kids, if everybody feels comfortable being naked at age 7 and it's cool at home, that's okay, it's okay. But as long as they have the sense of, okay, well, but when I go out, it's probably better to have clothes on. And, there are things that are part of being part of a bigger community outside of one's home, and we teach our kids about that too. So I think you might frame it in the sense of there might be some changes that you'll notice in your body, and there could be a time where you don't feel comfortable being in front of brother or sister or even mom or dad, but, we can talk about that.
So I just got a quick question. I'm a real protective father. Like I like to protect my 16-year-old son from the real world, as I should say. You got to hang out with the right people, talk to the right girl, and so on and so on. And I hear a lot about encouraging, trying to teach your kids about sexual health. What about how do you teach them the cons, the pros and the cons? Because let's be honest, a lot of us, we started out, we wasn't settled in, we wasn't responsible enough, we wasn't all of the above. What about the cons of sexual health too, though? Because I got a 12-year-old daughter too, and I got a 16-year-old daughter, and I got a 16-year-old son and a 14-year-old son. So how do you teach them some of the bad stuff that goes with it? Having sex at a young age can also cause transmitted disease at a young age and have kids at a young age. I didn't settle down until I was like 30-something, so I'm just being honest. So how do you teach your kids also the cons of that too, though? That's the question.
I think that's part of the conversation. First of all, thank you for being the brave man to speak up here. But if you were teaching your kid to drive a car, you wouldn't just teach him how to step on the gas. You'd teach him how to step on the brake too. It's the same thing. You're going to teach them about how to recognize if something's unhealthy. So when we're talking about health, it's also recognizing when something is unhealthy. So if a relationship is unhealthy, you want them to think about that. When you're talking about sexual health, what comes along with that is responsibility. And part of your role as parents is teaching them about learning responsibilities. And when you become sexually active, it's the responsibility of, taking charge of your sexual health so you don't get a sexually transmitted infection, so that you don't have an unwanted pregnancy, so that you're not being coerced into something that you don't want to do. So that's all part of the sexual health talk, is also letting them know and be aware of what are some of the unhealthy aspects that can go along with that too.
Just show them pictures.
I think every kid is different. Some kid might be like, Mom, don't. But I think if they want information, I think you can be that conduit of information. I wouldn't put it out there, but I think you can ask them, like, would it help to see a picture? Would it, because some people, they don't want to see a florid, in fact, just knowing that they can get an infection or a disease or cancer is enough. They're like, okay. But if they want more information, you can be that conduit of information. I don't know if you guys have anything else.
Back here. So this is along the same lines as the 7-year-old twins question. My kids are 8 and 9, boy and girl, and they have always loved to snuggle with mom at bedtime. We're past the I fall asleep in the bed and end up in bed all night with them long ago. But is there a hard and fast age at which that is like disrecommended to lay down with your children at bedtime in terms of like sexuality? That's just my...
I don't think so.
I don't think that there is. It seems to, as kids get older, that they will kind of naturally start to go away from that. Yeah. And so in terms of their own health, et cetera, if they're still snuggly at 8 and 9, I guess enjoy it for what it's worth as long as you're sleeping.
Yeah,
you know?
It's not gonna last.
It's nice to still have that kind of a bond. And as they get older, they may start to distance themselves a little bit naturally, but there isn't any known, harm to having that kind of a relationship. And if they start to feel uncomfortable being too physically close, then they'll kind of start to separate a little bit, but it's totally fine.
So I have a child who identifies as transgender and has a partner who is not comfortable with that identity, and so they don't follow that. They're not doing the things that they would do absent the partner to kind of transition. We've given a lot of resources, we've given a lot of support, but absent that, and we've talked a lot about, this is unlikely to be the person that you're with for the rest of your life, but, teenagers. So do you have any recommendations on how you would, should you push more? That kind of stuff is sort of the place that we are struggling.
I think what you've identified is that your child is not in a healthy relationship because the person that they're with is not accepting them for who they are, showing them respect, valuing their identity. It could be the same thing if you had somebody who was not respecting you in some other way. So I think that you're doing the right thing by expressing your concern. I'm concerned because I love you a lot and this is what I'm seeing coming from your partner. If you look at individuals who are in relationships that aren't healthy, there usually comes a self-awareness, right? If we're told, you can't do this, you shouldn't do this, sometimes especially in the adolescent brain, we do it. We do it more. And so I think recognize, and you've done this, you've recognized that relationship may not be the right relationship in the short term or the long term because that mutual respect is not there. I think, being aware if there are any behaviors that could feel dangerous, coercive, really, really unsafe, any emotional or physical issues or concerns about coercion or abuse, those are, hard stops. Or as a parent, you may have to say, this is not safe. We can't allow you to be with this person anymore. But short of that, it sounds like you're doing the right thing of saying, this person doesn't love you for who they are. And I hope that you'll get to the point that you'll see that.
Mine's more of a men's health question. I have a friend who is a survivor of testicular cancer, and being raised with 3 brothers, dad, and many male friends have asked them, did anyone ever tell you to check yourself? And they all say no. So I'm just kind of curious why this isn't promoted in the medical community, and many boys are raised by single moms that at very young ages you are no longer in a private setting with them to even see them or inspect them or anything. So just kind of curious why that really isn't very promoted in the medical community for boys.
I can answer that one. So that topic's actually been researched, and it has been found that the self-check for testicular issues has caused more harm than good in medical procedures that were done subsequently. So that's why it got a rating of don't promote that to your patients with doctors. However, I do think it's important for men as well as women to be comfortable with their bodies and understand their own parts. So I think it's always appropriate to have that conversation. I always tell my patients, especially when we're either about to do the exam or we've finished with the exam. Look, if you ever find anything that you're concerned about or you don't understand or seems different, come back in and we'll check it out for you. I think younger men, like younger women, get scared when we use the cancer word, and they have a hard time dealing with it. But there's other issues that can arise that can be very perplexing and distressing for men, and also feel like they don't have a place to go. So hopefully they have a good connection with a medical provider that can help them do the exams. But that has actually a D rating in our classification to not do that or promote that. But I still think it's important to know your body.
I have a 13-year-old boy, and I just kind of been curious about, with the hashtag #MeToo movement, how do you initiate the conversation of no means no, and when should you, and consensual, and talking to them about that, because I've kind of started that with him, but I don't think he's at that point, so I think he kind of just blows me off like, I know, and so it's just, do you just keep reiterating that, or having that open conversation?
I think when he says, I know, you say, okay, tell me what you know. Tell me what you know. Teach me. What do you know? What do you understand? Kind of doing that self-check, making sure that if that the things that he says he knows, he does know. I have a 4-year-old and a 19-month-old, so I don't have teenagers. But I have a book that I bought that should be called Humanism for People, but it's called Feminism for Boys. And I really like it because it just talks about no means no. No means no for everybody. No means no. Doesn't matter, right? So no means no, and the kind of the respectful boundaries. And I think those conversations starting there. I think we all have to be very aware of our interactions with others and how the intent of interaction can be interpreted and all that, and everybody has to be aware of that. So I would start with checking to see what does he actually know, and if you are satisfied with his fund of knowledge, then you could probably not push as hard right then.
Okay, this is going to be the last question, so you guys pick.
Hi. So proper terminology in my house is kind of like a thing that you have to have. So my 3-year-old does not yet know he has autism, so he can't really. But my almost 5-year-old does. And I was kind of prepared to have that conversation with him. I always have been. What I wasn't prepared for was him to finally come to me and say, Mommy, why is my penis hard? So I've always kind of said, it's okay, just leave it alone if you don't like that feeling and it'll go away. Is there something else that I can be saying to him that might...
That's great. That sounds
appropriate. Yep. Just tell him to keep it to himself.
Yeah.
It's really,
it does.
Yeah.
Normal.
That's great.
See? We're all doing something right here, right? These were big conversations, and it's not over. There's still a lot of questions, I know. I'm really grateful to each and every one of these doctors that set this panel here tonight. You guys did an amazing job. Give them a big round. I also want to thank each and every one of you for being here tonight. Thank you for being willing to get comfortable with a topic that can really be uncomfortable. You're paving the way for your children and paving the way for a better future. Now, each of you were provided with note cards here tonight when you checked in. We encourage you to use these for any outstanding questions that you might have. Write these questions down and leave them at the check-in table. This gives us enough time to get these questions back to our physicians so they can answer, and then we will have them up. Hopefully, what's usually the standard here? By like a week and a half? About a week and a half. That gives you guys a little bit of time. Back to the Patty Brisben Foundation.org. This is where you can find your answers. Each of you will also receive a post-event survey in your email. This will help us to improve the series and provide input on topics that you would like to learn about in the future. Speaking of the future, please save the date to continue this conversation, because I can tell it's not over. Sexual Health Matters. This event will take place Thursday, April 4th, where we will continue exploring this conversation on sexual wellness for our youth. At this time, we want to turning our attention to puberty throughout adulthood. So this is where all, Felicia, I promise you that question will be answered. So registration is now open for this. So you can go ahead and sign up. Don't forget, everybody who attends here tonight gets a free gift from Pure Romance. And I want at this time to, I want to pick the raffle winner.
Dun, dun, dun.
Those were not the winners. Susan Flowers, you are the winner. All right. And, thank you everyone for participating. Thank you for supporting Sexual Health Tonight, and thank you for your continued support of the Patty Brisben Foundation. Now what I would like for you to do with what you've learned here tonight, I want you to go and pay this forward to your friends and to your loved ones, and let them know about this next conference. I want everybody to leave here and have a safe journey home. Thank you again so much for being here.